The hospital shall maintain an adequate medical record for every individual who is evaluated or treated as an inpatient, outpatient, or emergency patient, which shall be documented accurately with all significant clinical and other information in a timely manner. The medical record shall be readily accessible for providing continuing patient care by medical and other staff, and permit retrieval of information for medical education, research, quality assurance activities, and statistical data source. At the end of this topic, we will be able to discuss the importance of keeping medical records, learn the appropriate indexing of medical records, know the prescription period of keeping the medical records, to describe files included in a medical record, the 5 elements of problem-oriented medical record, and to explain the importance of confidentiality of the medical data. What is a medical record? Medical record is a legal document providing a chronicle of a patient's medical history and care. Physicians, nurse practitioners, nurses, and other members of the healthcare team may make entries in the medical record. The medical record includes a variety of types of notes entered over time by healthcare professionals, recording observations and administrations of drugs and therapies, orders for the administration of drugs and therapies, test results, x-rays, reports, and etc. The importance of keeping medical records is to document the course of patients' illness and treatments. It is also to communicate between attending doctors and other healthcare professionals providing care to the patient. Collection of health statistics. It is also to serve as a basis for legal information to protect providers, staff, and patients, and for insurances cases. Medical records indexing is an important function since it involves organizing and storing information such as the patient's demographic and treatment information together in one place for easy retrieval later. This helps medical staff access all the information that they need quickly and easily to determine treatment options, as well as to be compliant with patient data storage and healthcare document management requirements.
Prescription period of keeping medical records. Ideally, records of adult patient are maintained for 3 years, 21 years for neonatal patient, 3 plus 18 years, for children, 18 years of age plus 3 years, and for mentally retarded patient, forever till hospital or the institution is working. From income tax point of view for 7 years. Files included in the medical records, front sheet or the identification summary sheet, consent for treatment, legal documents like referral letter, request for information, and etc. Discharge summary or referral slip, admission notes, clinical progress notes, nurse's progress note, and operation report if operation has been performed, investigation reports like x-ray, pathology, and etc. Orders for treatment and medication forms listing daily medications ordered and given with signatures of the doctor prescribing the treatment and the nurse administering it.
These are the 5 elements of problem-oriented medical records. First is the database. The database contains the patient's medical history including their lab results, x-rays, physical exam results, and etc. Next is the problem list. A complete problem list outlining the patient's medical issues after the hospital or clinic admitted them. It will also include information from the database. Third is the initial plans. It is based on the problem list. The physician will then write out a complete plan of action for the patient's care. Next is daily progress notes. The clinic will then update the POMR with the patient's progress as well as their medical problems. like one or multiple problems. And lastly, the discharge summary. Finally, the discharge summaries will outline the patient's care over time, like for example, from the point where you admitted them to their stay at the clinic or hospital. The importance of confidentiality of medical data is to create a trusting environment by respecting patient privacy, encourages the patient to seek care and to be as honest as possible during the course of a healthcare visit. It may also increase the patient's willingness to seek care for conditions that might be stigmatizing, such as reproductive, sexual, public health, and psychiatric health concerns. Confidentiality assures that private information will not be disclosed to family or employers without their consent.